Reporting, you saw a moment ago what the American Psychological Association thinks of this reparative therapy. We wanted to learn more about it, so earlier I spoke with Dr. Drew Pinsky, host of HLN's Dr. Drew. So, Dr. Drew, what exactly does reparative therapy mean? What does it consist of?
You know, many times they're using models for other kinds of behaviors that people have difficulty controlling, like addiction. So they're using things like 12-step models and those sorts of interventions. There's a lot of trauma therapies involved. And some of these treatments are quite legitimate. What's problematic is this idea that being homosexual or gay is somehow pathological and needs to be fixed.
Well, you say these treatments are legitimate, but there's not really any evidence that this kind of therapy works, right?
That's right. The treatments are legitimate. I mean, for instance, when I've talked to the guys that have either been through these treatments or used them, they're talking about trauma treatments and they're talking about trauma therapies, and I understand that. That's a legitimate thing to do if somebody's had trauma, but with the goal of changing somebody's sexual orientation, now you've gone completely off the rail. I mean, the medical establishment is going to great lengths to sort of atone for having pathologized this for many years. It was not correct. It is not a pathology, and there's no one in established medicine that believes that it is.
So the American Psychiatric Association, the AMA, none of them back this idea of reparative therapy, that you can pray enough and suddenly not be gay or go through other forms of reparative therapy and no longer be gay.
That's absolutely true. And not only that, though, even, again, the people that I've talked to that went through this, we dedicated an entire program to this one evening, and even the guys that have been through it are clear it's not like their sexual orientation has changed. They just can contain their behaviors a little differently.
It was interesting, one of the counselors and I don't know if the person's an actual therapist or what their qualification is, but I'll just say a counselor in that video was telling this person with the hidden camera, you know, it's definitely worked, you know, you can definitely change it. But in truth, as you said, I mean, you've interviewed a lot of people who have gone through this kind of treatment. I've interviewed people over the years who have gone through this treatment. And even the ones who claim that they are no longer gay, when you really push them, they will admit that every day they still have the fantasies, they still have the thoughts. They just are forcing themselves not to act on what appears to be their natural inclination.
That is precisely what I found. That is exactly what I found with those people. Now, they will also then say that, well, okay, but are you saying that people shouldn't have a choice to do something if they want to change? That's sort of what they'll hide behind then. And the fact is, again, it's exactly what you're describing. It's living a life that is not consistent with their biology and who they are, and it's pathologizing something that's not a pathology. And I'm not saying that there shouldn't be choices for people. I'm saying that having those choices might have a very significantly negative impact on people, and we need to take a look at that.
Because repressing yourself in that way, because living that kind of, you know, repressing your innermost thoughts, you're saying is not healthy long term.
I'm saying, of course, that would be a very difficult way to live, but I'm actually more concerned about the ambient culture coming down on people who otherwise would be able to live healthy, happy lives. Those are the people that really get hurt in the fallout from something like this. It's somebody who is coming to terms with this, who may be ambivalent, who begins thinking because they see billboards on the roadside that there's something wrong with them. Aren't you adding to discrimination and misery for people who then could be harmed by these options being out there so publicly?
It's also based on this notion that this is somehow a choice, which there's no evidence of.
Well, you know, you're absolutely correct. I mean, the idea of a choice it's a bizarre notion. I mean, it's like, think about it. For anybody has feelings about this out there, it's like a choice to like chocolate ice cream or a choice to like certain kinds of, be attracted in a certain way to certain kinds of people. That's something in us. It's a very deep biological piece of who we are as human beings.
Dr. Drew Pinsky, thanks.
Anderson, thank you.